Auzubillahiminash-shaytanir-rajeem. Bismillahir-rahmanir-rahim. Assalamualaikum. Ji ayanu, pakhair agale, ni hao, chunishumme, washmale. Ohaya gozaimasu, guten Morgen, hola, bonjour, privyet, kaifa hal? Hale shuma chatore, ahlan wasal, marhaba. Buna, mucho gracias, swabia, bhalli kare aya. Hoş geldin, nanayo sayo, khuyamora, chivato, chihal, jot, kalimera, khairutan. And a very warm welcome to everybody who's tuned into PTV World and watching World this morning. Alongside my very well-learned colleague who happens to be Miss Haja Satti. I happen to be Shahzad Hassan Khan, and we hope and pray that everybody out there is doing wonderfully well, that you are ready to kickstart your week with us. And ladies and gentlemen, we hope and pray that everybody out there will be manifesting a lot of good things to come their way, and that too from Monday morning, which is today, right now. But first things first, hello Haja, assalamu alaikum. How are you feeling today?
Walaikum assalam. Thank you so much for introducing me, Shahzad. I think the heat is very intense nowadays because of the heat wave.
Yeah.
And while you talk about manifesting good things starting from the Monday, I don't know why did you talk about the Monday particularly, because Monday is usually the start of the week that gives a dread to a lot of people, right? Because you have to start your day, you have to start your week, and the weekend is eventually over, and then we are waiting for the next Friday to hit up. And then we can get the rest. And because of this intense heat wave, there are lots of precautionary measures that government, and there are lots of messages that are floating on the WhatsApp. So please comply with those and make sure that you are not just looking after yourself, but also the people and the animals around you in your environment, because they also need a protection from this intense heat.
Exactly, and not just that, Haja, I think I'm going to request our producers as well to kind of allow me to wear something else other than the suits as well, because I think it's just getting too hot in here as well. And if you want me to wear suits, why not turn the ACs on, and that too on 16.
And thank you so much for pointing it out, because there has been for quite some time debate going on around how we need to change our attire, particularly uniform, to adapt to this changing climate reality. Because if you see the guards, if you see the people who are wearing the uniforms, the kids in the school, so the uniform is very, it's not attuned to the reality of the climate change nowadays. You know, you will see that they are wearing trousers and shirts and the very warm sort of socks. And it does not.
And those boots even, you know, you look at them, you feel more hot. You're like, okay.
God, yes. And they're all red over their face, and one can see that they are intensely perspiring and the sweating they are facing. So we need to rethink our approach towards this uniform and make sure they are attuned to and suited to the climate change realities, because obviously when we talk about protection against the heat wave, when we talk about protection against the changing climate realities, attire is one thing that we need to be more mindful of. And the matter of the fact is that they are mostly standing outside in the heat and performing their duties usually, and then it's very intense. And then there's intense also, what do you call it? I don't know what is the right word for the hubs in English. So pardon me, because my English is failing me at this point.
Even I'm trying, but it's failing me
too.
Yes,
yes, the intense heat that is going on. So we need to find some alternate ways, and there needs to be intense debate on that, especially at the school level, because they can easily change that, right? When it comes to the government bureaucracies and all of the other bureaucracies, or we know that the bureaucratic procedures are very intense, and there's a lot of red tapeism involved in that. But again, when we talk about combating the climate change, the heat wave, we need to be more mindful of approach, particularly towards the attire.
Exactly. And, you know, thank you so much, Haja, for pinpointing it that way as well, for all of those people, you know, for whom, you know, for example, outside their houses, we see a lot of security guards as well. Please make sure that, you know, they have ample cold water to drink as well. They have fans, you know, all of those basic necessities that they require. So it's not really important for you to kind of have a security guard outside your place, but please make sure that they're living just like the way that you would want to live in this scorching heat as well. But other than that, okay, you know, so we have most of the time spoken about over here on our show as well, and that to blue economy, right?
Yes.
And a lot of times you've spoken about Maritime, and you know how Maritime can actually contribute towards our economy as well. Now there's this wonderful initiative which we will be talking about. This is the second conference of its sort as well. We're very lucky that we've actually been joined by an expert who will be speaking about it. So ladies and gentlemen, let's welcome all the way, you know, on Skype from Lahore. We are very lucky that we have been joined by the Assistant Director, Center of Research and Innovation in Maritime Affairs at Minhaj University, Lahore. She happens to be Dr. Bakasia Naeem. Hello, assalamu alaikum, good morning. How are you, madam?
Walaikum assalam, and a very good morning from Lahore.
Thank you so much, Dr. Bakasia. First of all, first things first, how's the weather in Lahore?
Oh my God, don't ask about the weather. So you are talking about the heat wave, and it is too hot here in Lahore. I guess it's better for you to be in Islamabad.
Well, the temperature only varies like 1 or 2 degrees, but it's going to have its impact as well. But thank you so much for joining us. Wonderful to have you over here. So let's get started with the concept of Maritime Conference. So the 2024 Maritime Conference will be taking place on the 30th of May. This is the second time that you are, or your university, Minhaj University, is actually conducting this conference. What is the purpose of this conference and how will it serve our needs?
Okay, thank you so much, Shazad. Before talking about the conference, I would like to talk about our center first. Let me introduce our center, that is Center of Research and Innovation in Maritime Affairs, that has been established at Minhaj University, Lahore.
Yep.
Now, the first question that comes to our mind is that why that center is needed, and also why it is needed in a hinterland away from the sea. As you know, there is no sea in Lahore, so why and how the people will relate to it.
Yeah.
Now, the thing is that unfortunately, maritime sector is the most ignorant or ignored sector, a sector in our economy. We are exploiting, rather over-exploiting the land resources, and we are not looking towards the oceans, which are full of treasures. And Alhamdulillah, God has blessed us with over 1,000 kilometer coastline. But the people, they are not thinking about that. Academia is not doing research. Media is not creating awareness. The policymakers, they don't know about this sector, and they don't have even the basic knowledge. So that is why we have established this center to create awareness about the maritime sector, to promote sustainable practices in maritime sector, and also to collaborate with other institutions so that we can work for our sector and people know about it and they change their land fixated mindset and they move on to the ocean resources which are still untapped and which are still available to us.
And Dr. Wakasia, specifically when we talk about the maritime sector and when we talk about the research on the ocean, so we see in the Quran mentions about that how Allah has created oceans where we are getting our fresh meat from and the ornaments that we wear, and it also talks about the ships that are cleaving through in the seas. And this verse particularly refers to the intersection of different industries that are converging when we talk about the maritime sector. So it's ports, it's shipping, it's trade, it's lots of other business. And when we talk about the climate change, so there are lots of focus on how to build the sustainable use of the economic resources that are present inside the ocean economy, right? So when we talk about Pakistan particularly, and what does your research say? Are we making the optimal use of the ocean resources? Where are we at this point of the time? And what are some of the gaps that you have highlighted when we talk about the blue economy or the resources related to the oceans?
Okay, thank you so much, Hasra, for highlighting the points. Yes, the God has guided us to explore the seas, but unfortunately, we are not doing it. And talking about identifying the gap, yes, we have identified the gap. We know that the people, they don't know about it. Simply, they are ignorant because they have never heard about it. Nobody is talking about it. Policymakers, they don't make policies that can promote our maritime sector. So this is what we people are doing. We are conducting seminars, we are conducting conferences, and let me share with you that in a very short span of only 3 years, we have conducted over 50 seminars, 3 national and international conferences, plenty of workshops, summer and winter school. And what we people are doing here is we are telling others, we are telling the layman, we are telling the academician, we are telling the policymakers that yes, we need to work for this sector. And blue economy is the answer to all the economic problems that Pakistan is facing these days. So we talk about the insufficiency of resources, but we are not ready to shift to the other resources that are available and that can be exploited, they can be utilized for Pakistan's economy.
Dr. Wakasia, what are some of the factors that you highlighted when we talk about why there is a lack of attention towards shifting towards this particular sector of the maritime research or maritime ocean resources? I mean, yes, we are not a very resource-rich country when it comes to managing our resources, but apart from the money problem, apart from the capital problem, what are some of the other factors that are hindering our attention towards going or delving into the deep oceans? And Pakistan has a Gawada port is one of the best port in the world because it's not a very deep sea, it's a deep sea port, right?
This is the deep sea port. Yeah, thank you so much, Hajra, and this is an excellent question. Well, every one of us is responsible. That the academician they haven't provided the research, the media they haven't talked about it, the policymakers they don't know about it. So simply, this is the ignorance because people are not talking about it. So that is the reason that no one is ready to do anything related to this sector. And let me share it with you that our university and our center is the only center that has been established in any of public or private university, especially in Punjab. You will not find any other center that is working for creating awareness related to this sector. So the people they don't have information about it, and you know that when people don't know, they don't talk about certain things, so they cannot change themselves to this sector. That is the main reason. And you're very right that we have the Gawada port. This is a deep sea port, but unfortunately, it is not being utilized fully as it should be.
So
And
we'll
this is a
certainly come
huge
back to
pleasure
that
for
point.
us, and we can take a lot of advantage from Gawada port.
All right, Dr. Bukasia, there are two points which I would want to highlight. Number one, obviously, first of all, let's take a good look at how the affairs are on land. Now, imagine that with a lot of resources being available, few have been exploited, and few obviously are areas where unfortunately we have not been able to do very well. Now, imagine that your university is now highlighting that okay, we really need to move towards maritime and make sure that we use or probably gain that capital which the maritime has to offer. Your university offering these conferences, how do you think that they have had an impact? Do you think that there has been a movement? Do you think that there are more people who are interested to kind of get into it as well? There are more people who really want to gain that capital which it has to offer? Because unfortunately, even on land, the best that we have done is to build societies. Don't you think that we really need to come up with plans which are more sustainable, that all of that aqua life which lives within there, that we are not hurting them? Imagine the climate change, the entire thing, how messed up kind of it got for all of us, and how out of hand the situation is. Don't you think that if your university wants to gain that attention, they really need to come up with sustainable planning? And in terms of sustainable planning, what do you think are the initiatives which you are actually kind of making sure that within the conference people will learn, and that we will move on towards more sustainable plans rather than just exploiting the resources which are available?
Yes, exactly. Shazadji, people were talking about the heat wave, the temperature, and then the climate change, and this thing has affected
Society जंगल
every
बनानी है,
aspect
अपने
of our
कंक्रीट के
life.
जंगल बनाए हैं,
We
उनकी
are
बात कर रहा हूँ.
suffering because of this heat wave, and then our sectors, different sectors are suffering from it. Our climate, our environment. That Pakistan is one of those countries that is hugely affected by this climate change, and we see that in the shape of floods and the other calamities that we very often come across. So this conference, which is titled as Sea of Opportunity, Enhancing Maritime Transportation and Global Connectivity, actually we are going to talk about the green practices. We will be talking about the green shipping practices, why they are necessary, why we need to clean our oceans, why do we need to keep clean our ocean, and we go for such practices that save our oceans for our future generations. And also we will be focusing on the sustainable ports, that why they are important, why the sustainability aspects need to be highlighted, because we need to do something to save our sector for our future generation. And then we will be talking about how we can connect communities through our ports, and then how can we build smart and sustainable ports, and also
Trade
that how
corridors as well.
the maritime workforce it can be established, or it can be benefited from the green practices. So this is the focus of our
And
upcoming conference, and hopefully this conference, rather it will be attended by academicians, it will be attended by the media persons, it will be attended by the Navy, the professionals, and all the stakeholders which are
And I
involved in
think that's a
maritime
very
sector.
good initiative, Dr. Vakasia, that you have, I mean, multitude of people attending it. It's more of a interdisciplinary and a cross-disciplinary approach which is required. But one of the things that stands out in your conversation and your conference that is very interesting to build upon is how you are talking about empowering the local communities through the sustainable shipping. And we have seen, particularly in the Karachi that how corporate greed is eliminating a lot of mangroves, which are actually the nurseries for shrimps and all of these fishes, and how the local fishermen are actually earning their livelihood because of the sustainability of the mangroves there and the ecosystem that they sustain over that, right? So obviously one thing is that we highlight the initiatives, right? And the other thing is that we walk the talk over that. So how can we combat this corporate malaise, this corporate greed that is so harmful for our local economic system or the local ecosystem that is there? And when we talk about empowering the local communities, obviously empowering fishermen is very much important when we talk about sustainable fishing or shipping practices.
Okay, thank you, Hajra. This is a very important aspect of maritime sector. The fishermen, the poor fishermen, how they are suffering. They don't know that how they can have more fishes. They can go into this sector. They can establish it as a proper industry, and they can get benefit from it. Now, what we people are doing here, that our researchers, they are providing cutting edge researches on fisheries, that how this sector can be improved, what type of fish, how they can that can be caught, and then how they can be preserved, how they can be exported to other countries to earn more revenue. So this is what we are working. Our researchers, they are working here. They are promoting the sustainable practices also in fisheries. And let me share with you that here in Pakistan, that is again very unfortunate. The people, they don't know that when to catch the fish and what type of fish should be exported to other countries. So these awareness campaigns are very necessary even for the fishermen, so that they can benefit from this sector. Instead, in the end, I'm sorry to say that they are not getting much benefit, and most of our fish, they are rotten at the end of the day. So this is what we are working on, and as academician, we are providing them the research, we are providing them the basic knowledge, and then that basic knowledge can be exploited by the policymakers while making policies related to fisheries, and they can further help our fishermen in getting knowledge about the sustainable maritime practices, especially related to fisheries.
I think this awareness bit is amazing. It will absolutely serve the purpose. Where people will learn. Whether what we require, what we need to do, and what's the way forward. How do you think that the pre and post conferences you will be able to gauge whether what impact you have made in terms of maritime, or probably when we talk about the blue economy, or how the aquamarine life is?
I guess the biggest contribution that we are making is that people have started talking about blue economy. The people have started talking about maritime sector. Before that, they don't know. And even when we started our center and we talked about blue economy, the people were like, what is this blue economy? But now at least they are knowledgeable, and they know that what this sector is about and what is our role in promoting this sector, and also with reference to the sustainable practices, that what is our responsibility. So our main purpose is to make people responsible for their act. We are making them knowledgeable. We are creating awareness, so that when they will go into the field, they know that what are the constraints, what are the things that they are required to do, and how they can do that. This is the contribution that we are making, and definitely through our winter and summer programs, and through these conferences, we gather people from all the walks of life, and we have deliberations on certain crucial issues, and after that there will be a declaration, and we will be putting forward some policy initiatives that need to be taken by the government. So this is our role that we are playing at Center of Research and Innovation in Maritime Affairs at Minhaj University, Lahore.
I think it's wonderful. Thank you so much, Dr. Vakasia, for being with us. Lovely to be in conversation with you all the way from Minhaj University, Lahore. And best of luck for your Maritime Conference, which is set to take place on the 30th of May 2024. All the stakeholders will be going and visiting. Please make sure that when you come out or step outside that conference, that you're very well aware of how the blue economy works and what the maritime holds for our country, motherland we call Pakistan. With that, ladies and gentlemen, we're heading out towards a short break, and after a short break, when you guys will come back, since today, Monday morning happens to be all about awareness, let's talk about accidents and emergencies, and how difficult it gets for us God forbid, if you end up in an emergency department in a hospital, and if the people are not capable over there, whether they'll be able to save your life? I think that's the question we will be targeting right after a short break. Good morning.
Welcome back, and like Shahzad alluded to, the conversation that we want to develop today happens to be 27th of May, and it is International Emergency Medicine Day. So what exactly International Emergency Medicine Day entails, and how we will talk about how unexpected and unplanned events can occur, accidents can occur, and how it can sort of catapult or burdenize the healthcare system. And when we talk about emergency medicine, and then we are going to further develop the conversation how particularly in Pakistan we are dealing with these situations, and also the impact of the climate change on the emergency medicines. Because like we alluded to our conversation in our beginning, that how the heat strokes because of the climatic conditions, how people are getting all of this unbridled exposure towards the sunlight, and how the scorching sun can affect your health. And we have seen that I think past in the 2019 there were 1200 deaths because of the intense heat wave, that too in the Karachi. So how are we going to explore the impact of the climate change and how emergency medicines are going to work? And with for that we are very glad that we have been joined by someone who happens to be the expert in this particular field. He belongs to Maroof International Hospital. He has been on our show enlightening us about his profession, about the field of medicine. And without any further ado, we are joined by the consultant in emergency medicine. He happens to be Dr. Mir Abdul Waheed Saab. Assalamu alaikum, Dr. Saab, and thank you so much for coming to our show.
Thank you, Hajra and Shahzad, for having me today
and
here.
Sir, so now let's build this conversation particularly, and we've seen that there is a dire need to observe this particular day, right? So please enlighten our audiences, why do we want to observe this day? And when there is an unplanned sort of an event or accident that happens, or the emergencies happen, how it is interlinked with emergency medicines.
Yeah, all of us always aspire that when we have a problem, we go to the best people.
Yep.
So what about emergency? Would you like that when you have an emergency where your life is at stake, at risk, your limb is at risk, and your eye and sight is at risk, you need to be seen by the people who know what they are doing.
True.
So that's what the emergency medicine deals. In a layman's term, this is the first hour of every disease. Be it an accident, be it a chest pain, be it an abdominal pain, be it any kind of emergency. And the reason for me being here today is to highlight that, like any other specialty, emergency medicine is a specialized field.
True.
And not everyone is trained to deal with emergencies.
Right.
This is a very new specialty in Pakistan. It only started about 5-7 years ago here. But internationally, this is also a very young specialty. In England, say for instance, about 50 years ago, it only started, and now we have our own Royal College of Emergency Medicine, and I happen to be the fellow of the college as well. And
sir, which is why, at this point of time, I wanted to ask you this, because I believe that it's of great importance, since we are talking about, the International Emergency Medicine Day. Now, what happens is that, for example, we will see that there's somebody who's a pediatrician, we will see somebody who's an oncologist, so other than emergencies. But with emergency, it can be any problem related to any field, and there's this one individual who's actually responsible to look after you. How does that happen? How does that take place? Because people have been specializing for years and years, and all of a sudden there's this new field, somebody who's an emergency consultant and will look after, may it be the kidneys, may it be the lungs, may it be the liver, may it be the eye, mouth, anywhere. So how does it really work, this specialization itself?
So the answer is that while we train our emergency medicine trainees, they rotate through all the fields of medicine.
True.
So say for airway, you mentioned earlier in the talk. So
I'm going to have that debate though, by the way.
So I spent 6 months working in anesthesia department, how to manage the airway. Then I spent about a year in medicine, then I spent another 6 years in surgery, similarly pediatrics, gynae and ops. So in all, the rotation takes about 5 years, and you rotate through all the fields of medicine.
So it takes you almost 10 years to kind of become a specialist.
The pathway is about 7 years to be the emergency consultant.
Wow.
Yeah. So that probably answers your question, that we only deal with the life-threatening things in that.
True.
Our job is to stabilize the patient. We don't say that we'll take him to the theatre and operate on him, but we'll say that we'll make it ready and stabilized so that he can be brought to the theatre, and if there is a bleeding going on, that
Right.
can be controlled.
And Dr. Saab, so now also let's explore, because you talked about that it's a very infant sort of a field and it's developing not just in Pakistan but also in the developed countries. So now also analyze the impact of the climate change and the climate realities and the impact it does have on the people's health. So government is constantly cautioning us about that how people are going to suffer or might suffer from the heat strokes that are going to happen, right? And that is a very emergency sort of a situation. So when we have a person who is suffering from the heat, number one, how do we identify that this is something, a person who is suffering from the heat stroke, and what sort of precautionary preparedness we need to take, especially as a layman, because this is a situation that is coming from a very personal tone. I mean, we are all facing these heat waves across Pakistan. How do we deal with that?
Yeah, I think this is a very pertinent question in the recent times. The first thing is that awareness about the possibility of having problems facing the heat. So that's, you guys are doing excellent job, and our meteorology departments and NDMS and all those, they are doing their job. So when it comes to diagnosing that, you need to realize that the heat has a pattern of diseases. The very first could be a simple heat rash, that you are exposed to sun and you develop a rash. Then the next is you might get a heat twitch, something like that. Then the next thing comes is a heat exhaustion. This is something at a warning sign. If you cannot pick a heat exhaustion, then it might become a heat stroke. So heat exhaustion is the thing which most of people ignore or don't pick up.
What is exactly that?
So
Can you explain?
the symptoms are that you might feel, first you will be exposed to sun, obviously, then you will feel intense thirsty. Then the next thing would be you might have severe headache and you feel like you're going to vomit or nausea. If you don't do anything, don't drink water, don't take yourself off the heat, the next thing would be that you might feel dizzy and then you might actually collapse.
But Dr. Saab, when we talk about the climatic conditions, and particularly when we see, for example, yes, there are people, for example, like me and Shahzad, so we are, alhamdulillah, privileged enough, blessed enough that we can move to the shady areas or we do not have to work outside. But then there are people living in Pakistan whose job is to work outside. For example, if you see the vendors, the street vendors, or people who...
The labor even.
Yes, the laborers, or even the guards that we were speaking about. So they have to have some sort of exposure from the heat because this is what their job demands, right? So how can those people protect from themselves? And especially the government is constantly cautioning that from 10 to 3, beware of not getting indirect exposure from the sun. But there are jobs that demand direct exposure to the sun. So what are the precautionary measures for them?
I think the first thing is that the times of job or the working hours can be streamlined in that you start early morning and then end by 11, 12 when the heat starts. So that's what's the first. But if that cannot be done, then the other thing is that you need to have light clothes where you can breathe the clothes through that, and then you have to cover your head with some kind of shade, which could be a cap, it could be even a chadar hamare log lete hain, and then they can actually soak that in water and keep it on their head just to kind of
avoid the
protect
heat stroke
the heat itself. So, but I think the best thing would be to adjust the working times.
Exactly, and I think everybody needs to do that, because imagine that in GCC countries, ladies and gentlemen, they have a labor union where what they do is that if they know that the temperature is going to go beyond 45 or 44, whatever the limit is, nobody will work, you know, so it's going to be a day off as well, and we certainly need such unions over here who work for the betterment of the laborers too as well. But in addition to that, sir, since we are speaking about International Emergency Medicine Day, I'll come back to where it's more about building awareness. Now what happens is that, you know, for people, a lot of the times, you know, the buzurg of the house or the elderly would be like, God forbid if it's a chest pain, you have something, this medicine, and you know, all of a sudden and go to the emergency. In which conditions do you think people will make it worse for themselves before they even land in the emergency department of any hospital?
Unfortunately, you know, self-medication is kind of a thing which it's, I mean, rampant all
Yeah.
over. You see, there is, I think, a joke is that somebody's, if you're in my emergency department, I put is that if you have diagnosed yourself on a Google and you're here for a second opinion, it's better to consult yahoo.com. So, that's
a good
kind of
one.
a thing we deal nowadays. But
Yeah.
I tell you, it's a very important question that sometimes people, we relate, say, I'll take the example of chest pain. We only relate that if you get a chest pain, that means you might have a heart attack.
True.
But in diabetics, they never get chest pain. They actually get atypical symptoms, which could be a pain in the upper abdomen.
Okay.
So they usually take it as indigestion.
Yeah.
Majority of the time, the chest pain or the heart attack is considered as an indigestion. So
Alright.
my request today would be that please, if you're a diabetic and if you're getting a pain in the abdomen, please consider that it could be because of the heart.
Exactly.
And there, if you take that indigestion pills and all those things, that actually will worsen the condition and you will lose that time, because if you are having a heart attack, it's our endeavor, and if you reach a proper emergency department, that your closed heart arteries are opened within 90 minutes.
Okay.
So if you spend time at home, then actually you lose that window, and then the heart muscle becomes difficult to revive.
And I've seen a lot of people do that as well, you know, so they do not feel well. They're like, okay, ma, you know, give me some water, give me some cup of tea. I'm just going to go to bed. And we have seen, unfortunately, that people never woke back up again. You know, so I think it's always best. We always have been recommending, me and Haja, and my team have even actually seen me exercising that as well. You know, you think for a moment that there's something wrong with you, rush to an emergency department. I think that's of utmost importance. But now, sir, let's talk about how we really need to standardize these practices, you know, within the emergency departments. You go to one hospital, the practice will be very different in the emergency department. Sorry, you go to another hospital, it will be different. You go to a public hospital, that'll be different. You go to a private hospital, that'll be different. Don't you think, as a specialist of the field, that we really need to have standardized practices of emergencies and the SOPs in place, so that wherever we go, we get the same treatment and we save lives?
Shahzad, I think that's what I am here for today. The main thing is that we have very few emergency medicine consultants in Pakistan. I would say out of our own program, which is run by the College of Physician Surgeons of Pakistan, we have only graduated maybe 15 or 20 in the last 3-4 years. And there are almost about 200 now in the pipeline in the next 5 years. So that's not enough.
Okay.
We need look at the number of hospitals you have in the country. So every hospital, unless you have an emergency consultant who knows what to do, then he can only teach the others.
Right.
Until that happens, it's very difficult for anyone to just walk into an emergency department. Unfortunately, what happens is that anyone who is a new doctor, they just appoint him and place him in the emergency department. Whereas, as I alluded to, this is the field which really requires the best of the best
And this
to
is,
be in there.
you know, this is the very first time that I'm actually hearing it from a doctor himself,
Yes.
that, you know, right after the house job, you know, where do you get a placement in an emergency department?
Exactly.
Do you think that's the place where a new doctor needs to be?
Exactly. But if he is there, he needs to be supervised by somebody who is
True.
their senior, and they are the ones. So in our hospital, for instance, Alhamdulillah, we have the best people in the emergency
Like
department.
Maroof International,
And
yes.
I actually, we were discussing offline there, that you alluded to a trauma team concept,
True.
which you were talking to.
True.
And I can, Alhamdulillah, say that we are one of the few hospitals in Pakistan who actually run a trauma team.
Wonderful.
And I am the trauma team lead myself. That means that whenever there is a trauma patient comes in, I start the treatment, and then I get my colleagues from the surgery, from neurosurgery,
Right.
from cardiothoracic surgery. We all deal as one team, but we have set principles and guidelines. I'm not going to do it from my own set, I want to do this. No, what is the guideline? And we have guidelines already mentioned and approved guidelines that this is how you treat a patient.
So, but in addition to this, Haja, very sorry, because I think it will actually answer a lot of other questions which people might have, and that is that, now, for example, if somebody, because I've gone through it myself, unfortunately, my uncle who passed away just very recently as well, Nalla Raju. So what happened
Sorry
was
to
that
hear
he had a stroke. Now, when he had a stroke, you know, because as his family members, we would never know what's wrong with him, right? So we would take him to any hospital which is nearby. So that hospital took him in, you know, for a while, and then later on realized that, hey, you know what, this is something else which is beyond our competency, and all of a sudden came back to us running after 2 hours of he being admitted in an emergency department, that hey, you know what, you need to take him to another emergency. Now, how do you think that, you know, emergency departments really need to realize whether what patients to take in and what patients to not to take in?
Yeah, that also depends on the people then who are running those departments.
Okay.
You know, that unless I know my limitation, one thing in medicine we always say that you need to know your limitation, because our oath says that we do no harm, and if we can't help, we should not deteriorate that.
True.
And the first principle is that if something is beyond my competency, I need to straight away say that no, look, I will make sure that you reach a proper place and I
True.
tell you where to go.
Okay.
But unfortunately here in Pakistan that doesn't exist. That's what we are trying to inculcate within our young doctors, and there is a lot of efforts being made by the College of Physicians Surgeons of Pakistan. Royal College of Emergency Medicine is has started a very recent program about the foundation building within the emergency department.
Okay.
And Shaheed Zulfikar Ali Bhutto University is taking the lead in that. So we
Right.
have about 200 trainees at this moment who are being trained in that. So it's all about training the manpower, bringing that
Competency
within the field, and
efficiency.
also awareness among the general public that when you go to an emergency department, you need to ask, do you have an emergency consultant?
True.
And if that's the case, then you feel that you are at the right place. But if not, that's the stroke thing I tell you. The stroke is that if somebody has a weakness on the face, weakness of the arm, having difficulty in speaking, we all know that this is called a fast positive, means face, arm, speech and time. So within 4 hours, we have a time, if we can give them a clot busting drug, that weakness can go away. But it
Okay.
all depends on that. So fortunately, there are about 3 centers in Islamabad where we can do that, and Maroof is one of them.
Wow.
So this is from your program today, we can say that if somebody has these symptoms, please bring them to a proper emergency department where
Right.
they can get treated.
And Dr. Saab, one last question before we wrap up the segment, and because of the paucity of the time. So we've seen that how antibiotic resistance is cropping up inside Pakistan, and we've WHO actually reported because of the unrestrained use of the antibiotics, there were 60,000 deaths that were reported in 2019. And that also interlinks with one of the very important concepts that you highlighted in your conversation, which is the self-medication that is very common in Pakistan, right? So how can we deal with this pertinent issue of antibiotic resistance that is cropping up, and how can we deal with that unseen enemy that is getting so stronger and stronger in terms of this resistance?
See, this is just the tip of the iceberg which you mentioned about. The problem again comes that the self-medication and then the availability of medications. You walk into any pharmacy and you ask for any antibiotic, you are given that.
Right.
That's a regulatory problem. It should not happen. The Pakistan Medical Dental Council and the regulatory authorities have clearly said that these antibiotics should not be dispensed without a prescription. But
Right.
unfortunately पाकिस्तान में आपको पता है यहाँ पे तल्लक है, जुगाड़ है, हर चीज़ है.
True.
आप जाएं, anybody can walk into any department and get any antibiotics. I tell you about our own hospital. We have an antibiotic stewardship program where I cannot write certain medications. Only the ID consultant or the critical care consultant can authorize those. And if I write a certain medication or an antibiotic, my pharmacist has the authority that he will not dispense it.
Right.
That's what we need to have in the hospitals within. But for general public, I mean, the two sides of it: one, we need to restrain from self-medication,
Right.
and the other, the regulators have to act, and the pharmacies should not dispense at least the antibiotics without prescription.
Exactly. Thank you so much, Dr. Saab,
Thank
for
you so
being with
much.
us. Thank you so
Thanks
much
so
for
much.
to speak about such an important topic, and we certainly need to have more conversations about it. Thank you so much to Maroof International Hospital. Thank you so much to you too as well for coming down over here and taking out time for all of our viewers who are out there in 46 different countries. And I think it was a great piece of information, knowledge for all of us. Thank you so much, sir, once again, Dr. Mir Abdul Saab, for being with us.
Thank you, and I'm eager to come back and talk. further.
Inshallah,
Thank you.
inshallah.
Thank you
And
so
for
much.
everybody who's out there, ladies and gentlemen, you know, for all of what we do over here is to make sure that we raise awareness about all of these issues as well, which is why we stand out in terms of morning shows as well. Shukr, alhamdulillah. But very quickly, because certainly it's the same fraternity that we work with every single day, and there's been an unfortunate news of the passing of the veteran actor Talat Hussain Saab as well. So may his soul rest in peace. Talat Hussain Saab has been a great legendary actor who's actually performed for Pakistan and Pakistan television, and that too from a longer time. I remember him from the drama Kashkol, maybe his voiceovers, maybe his acting. I think he's been phenomenal. And the veteran actor Talat Hussain Saab passed away in Karachi after prolonged illness. Talat Hussain was one of the pioneer voices of Radio Pakistan and a legendary artist of Pakistan television and cinema. As I've mentioned, he was born in 1940 in Delhi, and his professional career spans over half a century. Acting President Sayyid Yusuf Raza Gilani has expressed profound grief and sorrow over his sad demise and prayed for elevation of his ranks in heaven. He said Talat Hussain's valuable service for fine arts will be remembered for long. So Talat Saab, may your journey be of ease from here onwards as well. And while you've been around, alhamdulillah, you've had long-lasting impact, and in days to come, we will certainly be eyeing at the kind of milestones that you have achieved, so that we will be able to do that once, to be that veteran in our field as well. And you, alhamdulillah, gained a lot of respect, not just in Pakistan, but all over the world. And obviously these are the visuals from his funeral prayers as well. So for everybody who's out there, please remember him in your prayers. Not just that, ladies and gentlemen, I'm going to request all our fans, our teams, our people who are out there, please remember him in your prayers. Inna lillahi wa inna ilaihi raji'un. And may the patience be there for the bereaved as well. So for his family, for all of those people who are out there, condolences from our way, from Pakistan Television's family. Look after yourselves until next time. Allah Hafiz.
Allah Hafiz.
Thank you so much, sir.